Robert Antolak from the Gentle Dentist, and today we're going to have a patient who actually had broken off one of his teeth, and you can see it right there. It's broke. Well, you can see on the X-ray it's broken off, but it is broken off right to the gum line. And what we do is we made a decision to extract the tooth and put a dental implant in at the same time. Now, the video that you're going to watch does have details of drilling into bone and some blood. So if you're sensitive to that detail, then you can just turn this off right now if you want. But basically, a dental implant is it's a titanium threaded screw, and what it does is it actually goes into the jawbone. So it looks like this. This is obviously just a sample of it. They're obviously much smaller than that. And today we're going to use one 4.2 millimeters by 13 millimeters long. Okay. So basically this gets screwed into the jawbone, and it gets screwed right there. And then what we do is we then put an abutment on like this, it's called, and this is what gives us the ability then to put a crown or a cap over the top of it, which would be something like this, and that's going to go over the top of it, and then eventually our patient will be able to move forward and be confident with the smile. Now, what we're going to do today is we're actually going to be able to place that implant in and the abutment on, and to give him a temporary crown that he's going to be able to not really use or chew with, but it will give him the ability to smile and not be embarrassed about that. And so that's what you're going to see today. And basically we can pre-work these cases up like this by looking through our three-dimensional CT scan called the cone beam CT scan. And this is showing this tooth right here, and that root of that tooth sits just like this right here. You can see that, and we're going to place that implant in that position right there. And I'm doing this by freehand. In other words, I know the position because of the technology here, and I know where it is in relationship to the root of the tooth, and so I'm able to put that in just in a very predictable, quick fashion. So this right here is showing what that root looks like clinically in the mouth. We can see that the gum line is right here, and the tooth is broken off right at the gum line, right where that is. We'll start this so that we're going to go ahead and just put some pressure on this root of this tooth, and then help it get, he's nice and numb. Phil's doing just fine. So we're going to go ahead and extract this now. So you're just going to feel some pressure here, and we'll just take a while to do that. And so try to conserve much of the bone that's on the gum line there.
So what we did was we pre-planned out this entire case by determining the size of the implant and the position of the implant. We also looked at the amount of bone that was covering over where the implant's going to go. This is really important because it shows us exactly where the bone is, because we do need to make sure we have enough adequate bone over that. Right now we're going ahead and just removing some of that infection that was around the root of this tooth. This tooth did break down, and so after we get done removing that soft tissue, we clean it out. Then we go through with called osteotomy burrs. They're basically drills, and they're different sizes. We also add some lubrication to them as we do that. And right now we're just going ahead and making the hole just a little bit larger. There's some irrigation right there that we're placing on it, and what it does is it just kind of cools that bone down. We don't want to get that bone to be too warm. Right now the implant's going in, and you can see that we're just kind of screwing that in place there, kind of like a wood screw basically. The hole is a little smaller so that we can create enough torque, and the threads of the implant actually screw into bone. Bone is flexible enough, especially in the upper jaw, where you can kind of undersize it, and then just really a lot of feel. It goes a lot of feel into it, and then we want to put that implant so that it's in the right place. Sometimes people, especially this case, when he bites down, his bite is very tight, and when the bite is tight like it is it makes it, you've got to be very, very, very accurate where we place it. And as we see there, where the implant, the cover screw right now, we're putting a little cover screw over it. Then we're going to be placing some bone graft. That bone graft needs to go around, which is here. It's actually cadaver bone, and it is particulate bone. It's sterilized, and it acts as scaffolding. Over time, his natural bone will take the place of where that is. Now we're just packing it in, mostly trying to pack it into the side that faces the lips and the cheeks, and then that will eventually, like I say, convert over, and we're just condensing it and pushing it right into where that area is. We're putting as much of that as we can put into it. We also mix up our cadaver bone with an antibiotic that helps to retain the grafting material and to prevent it from becoming infected. This helps to make sure that we have a good long-term stable situation.
Thank you for doing this. We just put an implant in. He had a broken tooth that it broke off for a while, and we had to take the root of the tooth out and put the implant in, and we're actually able to temporize it right away and then make it look decent. So Phil, what was it like having that done?
It was painless.
Painless?
I've been coming to Dr. Antolak as well as my wife for many years, and I couldn't recommend him more highly. I'm a gagger. If you're a gagger, that's what you want to come to, because for my entire life I've gagged, and Dr. Antolak helps me through all of that.
Yep, absolutely. We have a good relationship, and that's what it's important about. So
Yep.
yeah, thanks. So we're going to be letting this heal for about 4 months or so. Then we're going to put the final one on. But for now, we're able to get him so he's got a tooth. So everybody looks good. So you can
Thank
smile
you very much.
for Easter pictures. Right? Okay, thanks.
Yep. Less embarrassing.
So after that root is removed, as you can see on the video of the clinical video, we use a paralleling pin that helps us to make sure that we're in the correct location between the natural tooth here and a previous implant that we placed firm right here. And then after we are done using that and confirming that, this is an x-ray post-operatively of what that implant looks like. So as you looked at that previous picture of this screw that was here before, it looks kind of like that. You can see the thread patterns on it. And right now we did to a graft in it. That's the white particles that you could see on that video. And that gets packed around for the voids that were in where the root of the tooth was. It helps it to heal without getting resorption and compression of that area. So that's what it looks like with that implant in place. We were able to put an abutment on it like I showed here. That goes right here, and you can see that, and then it gives us the ability then to put that crown on, which you can see during the last interview that we did with him, which shows that he's got a tooth there. So it's great stuff. It's very conservative. I called him later on that evening, and he had absolutely no pain at all. He was doing great, and he's not embarrassed anymore. If there's any questions, our cell phone is, our number is 586-247-3500. Thank you and blessings.